Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. Mallard Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. lawmg.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. rural.indiana.edu. And by WTIU members. Thank you.
Coming up on Indiana Newsdesk. Cases and hospitalizations from COVID-19 are at record levels for 2021, and that has officials sounding the alarm.
Our current total hospital census is currently the highest it has been in 5 years, and we're over 1,500 patients higher than our peak last year.
State health and business leaders continue to urge everyone who hasn't to get the vaccine. With the end of 2021 comes the end of Scott County's needle exchange program after 6 years.
I think we have had an amazing program here and that it's worked. I think we've had an amazing success here.
But advocates of the program are working to start up an independent exchange. And an increase in toxic algae blooms in the state's water supply means you could end up paying more for safe drinking water. Those stories, plus the latest news headlines, right now on Indiana Newsdesk. Welcome to Indiana Newsdesk. I'm Joe Wren. Well, COVID-19 is ending the year with a bang as cases and hospitalizations continue to soar. The state set a single-day record for 2021 Thursday with more than 12,000 new positive cases recorded. Hospitalizations topped 3,000 for the first time since last December, and only 9% of ICU beds in the state are available. 90% of those hospitalized in the state are unvaccinated.
No matter what you believe regarding vaccinations, one thing is true. Vaccinated people do better than unvaccinated when they contract the virus of any form.
As the year ends, almost 18,400 Hoosiers have died from COVID-19. Scott County's needle exchange will close its doors today despite it being credited with slowing the 2015 HIV outbreak. But as Mitch Legan reports, a group of advocates is working to ensure the county isn't without an exchange for long.
6 years ago, Scott County became the first place in the state to set up a needle exchange. At the time, drug users were sharing needles, and it led to the worst HIV outbreak in the state's history.
These are our syringes, so most people come in.
The exchange has been called the country's gold standard and is credited with getting the outbreak under control. But because of that, the county decided it had served its purpose.
I think we have had an amazing program here and that it's worked.
Kelly Hans was in charge of the exchange for the last 4.5 years. She knew there was always a chance the county commissioners could pull the plug, but it still stung when it actually happened.
I've worked with my people here for the last almost 5 years, and to think that they won't have anywhere to go, anywhere safe to go, anywhere, was just really disheartening for me.
So Hans quit her job at the health department and started a nonprofit with hopes of running a similar program. She started meeting with other advocates who were concerned that without a needle exchange, the county might find itself back where it was in 2015. William Cook was the only doctor practicing in Austin at the time. His office off Main Street was flooded with new cases of HIV and hepatitis C.
We went from nearly 200 new cases of HIV that year in 2015 to only 1 last year. And a big reason for that is the syringe service program.
The program provides drug users with clean needles and a place to dispose of used ones. But the one in Austin quickly became more than that.
I've been that person that's picked them up off the street, Thank God I didn't catch nothing bad, But with this place being open, man, you can come and get a clean needle. They feed you, they give you all types of resources, And it's not just needles.
Staff there offered vaccines and testing and connected people with insurance or other health care services. The exchange eventually became a cornerstone of Southeast Indiana's recovery community, connecting hundreds of people with addiction services.
14 months ago, I was I was living in a camper, strung out on drugs, and today I've got 14 months clean. I have my own home, my own car.
Cook says the exchange created relationships with a community that's often hard to connect with. Without an exchange, he was afraid that could be lost.
It's hard for a physician like me, wanting to help people overcome their addiction, to even find people sometimes. But through a syringe service program, we have unprecedented access to people for the first time, to offer them that hope, that opportunity.
Cook, Hans, and other advocates didn't want to see that progress go to waste.
I hate to call it a loophole because it clearly states that in the law, but we felt like we found an alternate route.
The section of Indiana code that covers needle exchanges allows the executive body of a county or legislative body of a municipality to approve one, as long as it operates within city limits. In November, Hans and the advocates went to the Austin City Council with their plans for an independent needle exchange. The council gave it the green light with a 3-2 vote.
To potentially, have the same issues resurface again on top of dealing with a pandemic as well. I just don't know if we could have handled that as a county, as a community, as a city.
Now, the real work starts. The city needs to find an organization to run the program and have the state approve it. And the new program would have to find funds, most likely through state and federal money. Many in the community hope the city goes with Hans and our new nonprofit.
I can remember coming into recovery and, they told me that I can do anything that I want to, just put one foot in front of the other and I can keep doing it. And that's what I'm doing. That's what I'm doing, and that's what the rest of us are doing in the recovery community.
But heading into the new year, the future of the exchange is still uncertain. The city council needs to put out a request for proposals, but council members say they don't have a timeline yet for when that'll happen. In the meantime, Scott County will be without a needle exchange for the first time in 6 years. For Indiana Newsdesk, I'm Mitch Legan.
The Community Development Financial Institution Fund is a federal program to expand economic opportunities in low-income communities. Sarah Vaughn reports on how CDFI-friendly Bloomington is making an impact locally.
An expansive renovation is going on of what is essentially a 7,500 square foot box in Bloomington's near West Side neighborhood. But when volunteers with Bloomington Cooperative Living are finished, there will be 18 bedrooms and 2 full kitchens and living rooms, a cooperative living space for families. Bloomington Cooperative Living Board member Zachary Donovan says the location is fantastic, but says the large house didn't sell because the renovation cost as a single-family home would be too expensive. Funding the project had its challenges, Donovan says, because it looked like a risky project. And banking and lending is about trust and profit.
It's just really different trying to convince people that you're not, that you are a group of people that have the capability of running an organization, even though nobody's getting paid to do it.
Donovan says he put roughly 400 hours into building relationships, including one with the leader of CDFI-friendly Bloomington. CDFI-friendly Bloomington partnered with a Massachusetts CDFI known as LEAF that has experience with social purpose ventures. Together, they financed the bulk of the mortgage. CDFI-friendly Bloomington also assisted with a grant from the city to support renovation costs.
They put in the time to figure out what we were doing and to understand that we were capable of doing this.
So what is CDFI-friendly Bloomington?
So we are a nonprofit corporation, and our mission is to make affordable financing available for community development projects, right? So that can mean a lot of things, but typically it means affordable housing, small business, public facilities, or nonprofit capacity building, things that have important impacts for the public that aren't necessarily terribly profitable for the lender.
Nationally, the CDFI industry has more than $190 billion in assets, but they're found mostly in bigger cities and not so much in rural areas.
So it's my job and our organization's job to organize our market, promote the borrowing opportunities and the projects that need money out to the CDFIs, find a fit, and to do the same for the CDFIs.
In addition to being a matchmaker, the organization provides technical assistance. And through its own loan enhancement fund, Payne says the organization can add capital, mitigating some of the risk for smaller CDFIs. Payne says the majority of the funding channeled so far has gone to affordable housing, but some unique local businesses have also been helped.
Hola.
Bloomington Center for Global Children is a Spanish-language immersion preschool. In the reception area, hand-colored Day of the Dead masks greet visitors. Center board member Crystal Love says the preschool sorely needed a heating and cooling system upgrade after its air conditioning system died last summer during 90-degree heat.
It heated up the toddler rooms so much that we had to close the rooms and send the kids home because regulations, you can't have the rooms get over 78 degrees.
The preschool landed a matching grant from the city to upgrade the HVAC system, as well as transition to more energy-efficient LED lighting. Over at the city's new Trades District garage, colorfully lit panels of textured tiles brighten dull stairwells. The installation's creator, artist Esteban Garcia Bravo, remembers feeling overwhelmed at the prospect of funding his first public art project.
To get the project started, I had to put down like 12 grand that I obviously didn't have, like in cash.
Cdfi-friendly Bloomington provided a very low-interest loan and helped him get additional funding through the Community Investment Fund of Indiana. Payne says the artist has already paid back his loan. Cdfi-friendly Bloomington is not itself a federally certified Cdfi yet, but a recent $125,000 technical assistance grant from the Department of the Treasury will support its efforts. For Indiana Newsdesk, I'm Sarah Vaughn.
Coming up next on Indiana Newsdesk. The 75th Safe Haven Baby Box in the state was unveiled this week at the Linton Fire Department, giving mothers a place to safely surrender infants. And residents could end up paying more for safe drinking water as an increase in toxic algae is fouling some of the state's water supply. These stories and more right here on Indiana Newsdesk.
Public media's role now is more than ever to get the facts out, to be as transparent as possible, and to tell the truth as we know it.
There's a lot of information out there, and it's really hard to know what you can believe, which is why I think people turn to us again and again.
It's public media's role to try to help educate and enlighten.
PBS continues to be one of the most trusted institutions in the country.
We really do go out and meet the moment as it's happening.
We are there at the front lines asking tough questions and getting important and robust answers.
We're playing a major role in combating lies, fake news.
As journalists, we are trying to bring the most fair coverage that we possibly can.
It's about digging deeper and talking to the powerful and especially to the powerless.
Public media is the place where you cut through all the noise.
We move forward by staying true to our values.
And on PBS, news is human.
Welcome back to Indiana Newsdesk. Greene County now has a baby box for mothers to legally and safely surrender newborns they are unable to care for. Pat Bean reports.
Monica Kelsey's 17-year-old mother abandoned her at a hospital just 2 hours after she was born. After learning her own story as an adult, Kelsey founded Safe Haven Baby Boxes. The nonprofit provides boxes at hospitals and fire stations where mothers can anonymously and safely surrender their babies. Tuesday, the 75th baby box in the state was unveiled at the Linton Fire Department.
I am so thankful to be standing on the front lines of this movement, ensuring that women have a safe option to place their child in their moment of crisis that my birth mother did not have.
Kelsey says 2 babies have been surrendered in Greene County this year before the box was installed, including one at the Linton Fire Department. So Linton Fire Chief Brad Sparks jumped at the chance to place a baby box at the station when talk of it first came up about 6 months ago.
It's extremely important. You know, you got to think about some of these young girls that don't know that there's an opportunity for this.
Baby boxes are climate controlled and accessed through a door on the outside wall of the station. Once a baby is placed inside and the door closed, alarms alert authorities that a baby has been placed inside. The boxes cost around $15,000 installed. The opening of the box in Linton came on what would have been the 7th birthday of baby Amelia, who was found abandoned at Eagle Creek Park in Indianapolis. She is the last deceased infant to be found abandoned in the state.
We used to find 2 to 3 dead babies in our state every year. Now we're not finding those dead babies, and we're finding those babies now in our boxes.
Kelsey says 6 babies were surrendered in baby boxes in 2020 and 4 more this year. One surrendered in February of 2019 was on hand Tuesday. Magnolia Higgs, or Nola as she's called, was too shy to speak at the ceremony But Tessa Higgs, who brought Nola home as a 1-month-old, said there's no shame or blame for mothers who surrender their babies.
I mean, it's such a blessing, and it'll give that child a forever home and a forever family that will just love them unconditionally.
For Indiana Newsdesk, I'm Pat Bean.
There are currently 92 safe haven baby boxes in 6 states across the country. As we get more warm weather and heavy rain events in Indiana, we could see more toxic algae blooms affecting the state's water supply. And as Rebecca Thiel reports, if things don't change, Hoosiers will likely be paying more to keep their water safe.
Samantha Bettinger is a doctoral student at Indiana University's School of Public Health. Late this summer, she noticed the water tasted, well, kind of like dirt. At first, she thought it was just the water at her apartment complex.
And come to find out, it was pretty much everywhere in the city of Bloomington that I had went to and had the water that I noticed that it was really starting to taste funny and kind of smell funny.
The city of Bloomington said the water was safe to drink, just unpleasant. But Bettinger didn't want to take any chances. She's originally from Toledo, Ohio, which made headlines in 2014 when a toxic algae bloom in Lake Erie polluted the drinking water. Thousands of residents went without clean water for about 3 days.
I've actually had this experience before where we went under a water boil advisory because the levels were so high, and that specific algae can cause liver damage. So we were pretty conscious about not drinking it, especially during that boil advisory.
With that experience in mind, Bettinger started buying water jugs to drink from at home.
I keep bottled water in my car, just so if I'm out in public, if I go to a restaurant or I'm out with people, I have access to better tasting water.
Bettinger wasn't alone. Many Bloomington residents were concerned about the water the city gets from the Lake Monroe Reservoir. Vic Kelson is the utilities director for the city of Bloomington. He says the odd summer weather created the right conditions for more blue-green algae on the lake.
September was very, very warm. Very, very sunny, and very, very dry.
Blue-green algae can produce chemicals in drinking water that do everything from make people sick to just affect the smell and taste, like in Bloomington. And dealing with them is expensive. Kelson says the city used to have issues with taste and odor every summer.
Yeah, they use granular activated carbon. This is powdered. This is really fine.
In 2016, the utility started adding activated carbon to help combat it, to the tune of about $100,000 a year. The city added even more this summer.
If we start to have more of these kinds of incidents, we may have to invest in additional hardware, additional chemicals, additional training. We have to be more vigilant. All of those things cost money.
Kelson says, fortunately, the city has lots of customers to help spread out that cost. So those big price tags for the utility become just pennies more for Bloomington residents. But algae treatment isn't all customers are paying for. Water utilities around the country have crumbling infrastructure that needs to be replaced, like lead pipes. According to Bluefield Research, water rates in the U.S. have gone up more than 40% in the past decade, rising faster than any other household utility bill. Edward Moore is the director of public utilities for Toledo. He says since 2014, the city has pumped about $500 million into its water infrastructure to prevent another catastrophe.
We can go to the state and get grants for road projects to the tune of 80-90%. They'll pay for it. And I know there's a highway tax and all that stuff associated with it. But if I do a water or sewer project, the cost of that entire project is passed on to the ratepayer. There is no government subsidy for that.
Moore hopes the infrastructure bill recently signed by President Biden will help take some of the pressure off of lower-income Toledo residents.
When we see increases in utility rates, it definitely affects people who are lower income the most. And in other situations as well, it can definitely affect communities of color.
That's Ann Scheckinger, the Midwest director for the Environmental Working Group, which tries to track algae blooms. In some ways, residents of Bloomington and Toledo might consider themselves luckier than others. Scheckinger says the Environmental Protection Agency doesn't actually require utilities to remove toxic algae from drinking water.
Anytime a utility removes algae that's toxic from their drinking water, it's because they care about residents that they're serving water to. So the EPA is not doing enough here.
The EPA did require some utilities to test for algae, but that requirement expired last year. Because of this, Scheckinger says people could be getting sick from contaminated drinking water and not even know it. Short term, it may just feel like a stomach bug. But some chemicals from the algae can cause liver damage, and studies have linked some to brain disorders.
So over time, exposure can be really scary for your health.
The EPA's internal watchdog group, the Office of Inspector General, says the agency needs to come up with a plan for how to handle harmful algae blooms. But even if the EPA does, stopping nutrient pollution is going to be a challenge. Maggie Sullivan is the Lake Monroe watershed coordinator and part of the nonprofit Friends of Lake Monroe. She says most people don't realize that what happens on their property could end up in someone's drinking water.
The watershed is 440 square miles, so there's people that are in northwestern Jackson County, and what they do on their property impacts Lake Monroe, and they may not even have Lake Monroe on their radar at all.
But there are things individuals can do right now to prevent more algae blooms on the surface drinking water sources that Indiana cities rely on. That includes taking care of your septic system, planting cover crops on farm fields, as well as trees and shrubs along streams, and using fertilizer only when necessary. Jane Martin chairs the board of the Lake Monroe Water Fund, which raises money to fund water quality projects upstream. She says water from Lake Monroe is the underpinning of not only Bloomington, but Indiana University and the local economy. The lake is habitat for wildlife and one of the top places for outdoor recreation in the area.
Lake Monroe was built in 1964 when IU ran out of water and threatened to move out. So Lake Monroe is all we have. We can't use Lake Lemon anymore, or Griffey, or what used to be called University Lake.
If the lakes, rivers, and reservoirs become too polluted to draw water from, it's not clear what other options Indiana's larger cities might have. Martin says that's why people in the Lake Monroe watershed and around the state have to address issues like algae now and not wait until there's a water emergency. For Indiana Newsdesk, I'm Rebecca Thiel.
Well, as 2021 comes to a close, we look back at some of the top stories of the year.
Ladies and gentlemen, as we continue to do these few things, the light at the end of the tunnel becomes brighter and brighter.
I'm not saying COVID is not real, but it definitively is not anywhere near as dangerous as they say.
We have the resources to care for those who are in need, meaning ICU beds, doctors, etc. We have a vaccine, 3 of them.
And that's really what we needed, was somebody to come in and at least give us a couple weeks of an extra pair of hands to help with those things that we want to do but just haven't had a chance to get to.
Normally, we have patients come in, you're with them for 2 or 3 days, they go home. COVID patients, we're with them every day for a month or better, and then sometimes they don't get to go home.
It's probably one of the worst things I've seen done to a human, maybe.
I see myself as being bruised, but she is broken.
I share that conviction.
Yes.
The law matters with us. Share that conviction. We debate what the law matters.
It doesn't matter what the Democrats.
I took an oath under God.
Democrats.
Under God.
People are kind of dispersing to other places in the community, which is honestly really what we were afraid of and worried about, is that people would go and find campsites that are more hidden and far away, and so we'd have less access to them and less ability to kind of keep an eye on them.
We gain 4, we lose 4. It's nobody's really coming in for jobs right now. It's a huge struggle.
They are unable to tell you that they're out of a product till they're at your door delivering it, and they'll say, oh, by the way, we don't have this, we don't have this, we don't have this, and we don't know when we're going to get it.
Right now, we don't have anything. We're out. In 60 more days, we got to have that lot full again. Everything's way out of touch, way out of touch.
I'm assuming if you were underground for 17 years and it's time to come out and, make friends and populate, you would make a lot of noise as well.
What people are telling me, how's this going to benefit me and my wife as homeowners here? I think it's going to favor the city more than it's going to favor the homeowners.
I think the question really is, what's good for the whole community of Bloomington?
Those people came and helped us out big time, and
I mean, they saved our lives.
The foundational element that I believe 10, 20, 30 years from now that this day is going to mark is fulfilling that academic mission.
Most of the people that have come through in this last year were people that went up and down 37 but didn't know how great of a downtown that we have.
It's not just about the needle exchange. It's also about people treating you like a human being.
I think refugee resettlement's one of the best things we do as a country. So not just reuniting families, but just giving people a new home and a new chance at life.
Jackson County Jail and any other participants in my sister's death must face charges.
It's been 2 years in the making, and here we are seeing the fruits of those labors.
And then, as always, more news at WTIUnews.org. Have a great and safe New Year's weekend.
Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. Mallard Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.